Hello, this is Jim Pellegrino, your host for the hour, and our second guest on the program is Chad Wable. Chad, pleasure to have you on board.
Pleasure to be here, Jim.
Chad is the president and CEO of St. Mary's Hospital in Waterbury, Connecticut. And Chad, I guess the first question I want to ask you, we got a little bit of time to spend together today, but on the way over, I heard on the radio that they think, the operative word being think, that there's a second Ebola case down there in Texas. So I got a couple questions for you. Number one, do you think, we only have one case right now, Chad. So do you think in the good old USA through the mass media, what we have here is a case of mass hysteria because there's only one, or is this a case for a viable concern?
Well, Jim, there's a lot of fear in the world right now about a lot of different things. So I think we got to be careful about the mass hysteria situation that can be created by this. I do think that it's important, though, that everyone takes the proper precautions here with this, because this is a real disease, and it needs to be taken seriously. So I think a little bit of it is mass hysteria, but I can tell you what, if it does proliferate, and then we can be in some problems here. But the good thing for us is at St. Mary's, I know we have a lot of procedures in place to deal with these kind of issues. I know hospitals across the country do disaster preparedness exercises all the time. We do a lot of isolation type preparedness events. So I wouldn't necessarily think we need to be greatly concerned. I do think we need to take all the proper precautions.
Is St. Mary's, specifically, is St. Mary's prepared for an infectious control scenario?
Yes, I do believe we are prepared. We have one of the best disaster preparedness programs, I think, across the whole state. We do a lot of mock events. We are.
So you simulate them?
We absolutely simulate them. In fact, we have one this week that's going on where we're going to be transferring patients out of one hospital into another hospital.
Yeah, the only reason I bring it up, Chad, is because I heard on TV this morning. I mean, you know the American media. I mean, once they are in the hunt, it's like a shark smelling blood in the water. And they found some person from the Center for Disease Control who said that, in his opinion, only 40% of all hospitals in the United States of America are ready for this. But you're saying St. Mary's is.
Well, that's 1 out of 2. That would be 15 hospitals in Connecticut.
Yeah.
And I think 15 of the hospitals could carefully care for any disasters or issues that come up statewide.
Okay. All right, speaking of disasters, let's talk about a political disaster in some people's mind. You're in the healthcare career field and have a senior executive position in it, in a hospital. The healthcare environment nationally, relative to Obamacare, aka the Affordable Care Act, what's your general feeling about that, and what are the implications to the wonderful world of hospitals?
Well, I think the Affordable Care Act, was another example of how the government is starting to get more involved in an economic issue. And I think it really ends up being an economic issue. It has to do with the Medicare program and the spending that's occurring and how much of the national budget it has become. And so this is an opportunity to ratchet down expenses. Now, I think hospitals in general have understood that we spend too much. And there's a lot of reasons for that. And I think we started actually prior to the ACA to start to reduce spending, to start to control utilization, to do a lot of the things that have been a result of the impact of the Affordable Care Act. I do think there's a lot of good that has come from it, because I think it's been a motivator to get hospitals to be more business-like, to really truly understand the patient's perspective in healthcare a little bit more. I think there are going to be good things in the future. I think this is the most exciting time to be in healthcare. This is the most exciting time to be in the hospital business. If you don't like change, then you shouldn't be in the hospital business. If you don't like excitement and...
Well, your challenge, Chad, is this, right? I mean, there is if this were the perfect line of patient care, with economics on one side and quality of care on the other, you got one heck of a challenge to keep yourself centered on that line. Right? Because, I mean, economics do drive this. You're absolutely right. And it's driving, the motivating factor is to drive the cost down. your balancing act is to make sure that you don't reduce your costs so much that the other side of the equation is being affected, the quality of care you give your patients.
Right. So at St. Mary's, for instance, the number one thing that we focus on is patient safety and quality, period. And so that's not compromised no matter what we do. And we try to find ways outside of that to make sure that we can continue to reduce costs, reduce utilization, and do the right thing. There's enough evidence and research out there that show that hospitals really aren't good investments right now. We're not. We are not good investments right now. And at St. Mary's, we're probably the best investment in the state. We're the lowest cost hospital in the state. We have the highest value-based purchasing score. That's CMS's or the federal government's score on hospitals. We're number one in the state of Connecticut. We are a good investment, and even with that in the state, we're not a good investment nationally.
Are you concerned about the reimbursement rates, though, Chad?
I'm not as concerned about the reimbursement rates as I am in the trust that's being lost in hospitals and healthcare across the country.
What do you mean by that?
I think that the American public, because of the media, because of a lot of I guess, influence and discussion and now knowledge just locally by consumers about healthcare, that there's a little bit of a trust that's being lost in us. I think that there's a notion that hospitals in general aren't as safe as they should be, that they're not as clean as they should be. And I don't want that to happen for our industry. And I think we got to work hard to fix that.
My editorial comment on that, Chad, would be I think the American people, generally speaking, have become cynical and have a lot less confidence, not just in hospitals or healthcare, but institutions. It could be Wall Street, it could be education, it could be healthcare. We've become very cynical about the care that our institutions give us.
And a lot of what the Affordable Care Act forces us to do is to be a lot more patient-centered in our care, to move care to the home, to reduce utilization in those institutions, to move care outside of those institutions in more convenient and accessible, less costly environments.
Okay, let's move on. Tenet Healthcare is a company that is in the process of acquiring you, right?
They are.
Tell us a little bit about that.
Well, St. Mary's has been searching for a capital partner for some time. We understand that we need to scale as an organization. We understand that we need to be part of a larger healthcare system.
When you say capital partner, you're talking money.
Yeah.
A deep pocket.
Yep.
Okay.
And a system that's going to be able to help us shelter some of these issues that we just talked about with the Affordable Care Act. As well as a future where reimbursements are going down. We're going to have to continue to reduce our cost. We need to use best practices nationally. This is a company that has 80 plus hospitals. They have 200 plus outpatient facilities. They have best practices that can be learned across all those facilities.
And you are a Catholic hospital.
They have Catholic hospitals.
Yeah, which makes a difference, doesn't it, Jeff?
It makes a big difference. We take the fact that we're a Catholic faith-based hospital very seriously, and it's great to know that this larger institution that has multiple hospitals and facilities has a lot of experience in Catholic healthcare.
Yeah, and for the audience's information, the research that I did on them, they've already purchased hospitals in Bristol, Vernon, Manchester, and I think also
Waterbury Hospital.
Waterbury Hospital as well.
So there are 5 that are being proposed right now. None of them have been completed. And so we're the first ones in the initial process. St. Mary's Hospital and Waterbury Hospital both have public hearings in October to get through the regulatory process. And we're hopeful for the first quarter of 2015 to be able to close on the transaction and move forward as a member of the Tenet Healthcare network.
Well, I think the other thing is, in part of the research is they own Catholic hospital facilities in Worcester, also in Tennessee, Missouri, and Florida.
And the previous CEO of the Worcester facility is now the president of the Northeast region. So a guy that has Catholic...
Of Tenet.
So a guy that has, his name's Eric Wexler. He used to actually be in the Waterbury area. He was at Mid-State Medical
Chad,
Center.
Let's wrap up this part by me asking you this question. In the strictest public relations sense, forget everything else, operations, quality, finance, in the strictest public relations sense, what has been the community reaction, the general public's reaction, when they hear that there's going to be a possible acquisition by a for-profit hospital?
Very positive.
It is.
Yeah, 99% of our medical staff, I would say 9+ out of 10, absolutely support and would want this to happen. And all of the forums that I go to discuss this, it's needed in such a bad way in Waterbury. It's going to be so meaningful.
So you have community support then, Chad?
We have a lot of community. We've already had one community public hearing that was very well attended and well supported. We probably had 10 people come up and testify, and I would say 3 offered some questions and concerns. 10 to 15 offered a lot of support.
Good luck with that, Chad. So what's the hospital of the future going to look like, Chad? Inpatient versus outpatient?
Well, I can tell you that there's going to be a movement away from the inpatient side of our
That's people
business.
coming in, staying overnight, 2 or 3 or 4 days.
Well, you know, I didn't know that it took 2 midnights to be an inpatient, and now the federal government has instituted some rule that says it's 2 midnights before you're actually an inpatient.
So they've defined inpatient.
I didn't know that the federal government had the ability to define inpatients, but I think that there's going to be continued tension on moving to the outpatient arena. I think we're going to be using technology, telehealth right now.
Right.
You can get on an application right now on your phone and actually pay, you know, $50 at 3 in the morning and see a doctor vis-a-vis your iPhone right now.
So what's going to happen from just a strictly facilities point of view is that there's going to be more of your facility that's going to wind up being dedicated to outpatient and ambulatory care than are going to be. How many beds you have, Ken?
We have 300. We're licensed for 347 beds. We operate about 210 beds. 1 million square feet of space. Wow. I can tell you, Jim, we don't need 1 million square feet of space in the future.
Right.
And we're going to want to take those outpatient services out to the community.
Right.
We're not going to want to provide them in this institution setting. So we're going to have to figure out how to deal with the fixed cost issue that could arise from that. But I think we'll deal with that. But what I really see is a future where people are getting their health care at home as much as they possibly can.
How about
leveraging
robotic
technology.
surgery?
Robotic surgery is an example of speeding up recovery time. It's an example of moving people out of the inpatient arena. We have the second largest robotic surgery program.
The Da Vinci technology?
Yeah, we have the second largest program in the Northeast.
Really?
A very progressive program led by Dr. Philip Corvo, and a lot of impressive things that we do in terms of robotic surgery. And I really feel that that's just another movement. You're going to see robotic surgery in the outpatient arena. You're going to see a lot of changes even with that.
You know, I read an article the other day, Chad. You know the drone technology and the remote weapons technology, where someone in Arizona can control the drones and the weapons that are flying in the Middle East. I was seeing something on TV the other day that there was a person remotely located 5 or 6 states over from us that remotely was doing robotic surgery in one of the hospitals here.
It's happening already.
Yeah.
It's absolutely happening, and it can happen is the thing. So, you know, do I think that that's going to be mainstream surgical procedures? No. But do I think there's going to be an opportunity to do some higher end surgeries where you have really high class surgeons that perform these narrow bands of types of surgeries where they could do them, you know, from one location, even if it's remotely? Do I think that could be very positive? Absolutely. It's a way to standardize care. It's a way to make sure that the pre-op, operative, and post-operative care is the same.
So on a scale of 1 to 10, what would you say the impact of technology is going to be on the healthcare career field, John?
Oh, it's 9. It's 9 to 10. It's off the chart. There's
okay,
no question off
so
the
what
chart.
that tells me is that if you ever made a strategic decision, and I can't imagine someone doing this, not to invest in technology, it's a death knell for whatever institution makes that decision.
Absolutely. It's a must-do.
It's a must-do.
It's a must-do.
I know for a fact that home health care is growing exponentially. So at the time you let someone go from the hospital and they go through the discharge planning and all that stuff, there has been a tendency in years past to discharge that person to some sort of an institution. There's going to be a propensity to discharge those people now to home care, where you will probably be part of, and affiliates you have will be part of delivering care in the home setting. How much of that do you see?
I see a lot of that. We're moving right now from what's called value episodic-based care to what's going to call value
episodic-based care.
Value. So we're going to move from volume episodic care to value-based care. And it's going to be much more of a capitated system where we...
What does that mean? What does that mean?
We're going to be responsible, we're going to get one payment for the total episode of care that a patient receives. And we're going to be responsible not just for the pre-hospital, hospital, but we're going to be responsible for post-hospital. Hospitals are soon going to be responsible for taking money in and paying home health and all the other issues. So there's a movement through the Affordable Care Act to force hospitals to start to build and scale up, just like we're doing with Tenet, so that we can start to be responsible for the total continuum of care. And then we'll be able to manage the total cost of care much better in the future.
And you don't think that bureaucratic structure will affect the delivery of care?
I think that we are going to be responsible locally to change healthcare.
Okay, so that says, I mean, let's simulate that for a second, Chad. What that says is that I come into St. Mary's Hospital with a problem, a major medical problem, right? I'm there for a couple days, I'm an inpatient for a couple days, and then I'm discharged. I go to my home for my recovery period, or in conjunction with the home, I may go to some physical therapy or something else. And you're saying that from the time I walk into St. Mary's to the time that I complete my recovery at home, you're going to be responsible for that?
We're going to start to take a lot more responsibility for it. It's the reason why you see insurance companies getting into the hospital business. We've got insurance companies right now. United has a sub-company that just bought 2 hospital chains in Portugal. They bought a hospital chain in Brazil. Why do you think they're doing that? They're learning how to be in the hospital business so that they can come to America and start to really get involved in the total care of patients.
And what do you call that again? You called it capitated care?
Capitation.
Capitation.
So we're going to get one payment. We're going to get one capped payment. One capped payment. For a total, care continuum. So if someone comes in for a robotic surgery, we're going to be responsible for everything until that patient is completely done with any rehab.
And so who's going to hand out the money? The federal government?
Whoever the payer may be.
Whoever the payer may be.
It may be an employer, because there may be direct-to-employer contracting that goes on in the future. It may be an insurance company. It may be the federal government. It may be the state government.
So if I were someone who was a caregiver to another person, under the system that you're describing, my interface would be with the hospital. I wouldn't get involved at the detail level with any of that stuff I'd be doing.
Well, your interface is really going to be with the doctors. Okay. Hospitals are much more in partnership with physicians now. There's over half of all physicians nationally now are employed or in some model where they're closely linked with hospitals. So your interface is going to be through your primary care physician. You're going to have primary care physicians.
So if you had to choose a word between 2 words for what's happening in healthcare right now, Chad, would you use the word evolution or revolution?
I'd say it's evolution.
You'd say it's evolution?
I'd have to say evolution. I couldn't use the word revolution because I think of revolution in a much more, pessimistic manner. And I really do think this is the most exciting time to be in healthcare. I think that patients in the future are going to get so much better care than they ever received. And we're going to move away from this institutionally based
Can we go all the way
healthcare.
back to the Affordable Care Act, Chad?
We sure can.
Here's the reason I asked that question, because in my mind, in a very macro sense, right, what I have in mind is 2,600 pages of legislation followed up by 20,000 pages of regulation.
None of which were crafted by any clinicians, doctors, or anyone that has a deep knowledge of health. Precisely. So, Chad, this thing that's hovering above us from 10,000 feet, you're saying at the ground level, you see when this thing comes down, it's going to be an evolution. I spend no time thinking about the Affordable Care Act. I think that
why don't you?
The Affordable Care Act is exactly what you said. It's a fog. It's a cover. it's forcing some changes in healthcare. But if healthcare is going to be fixed, it's going to be fixed from the inside out, not from the outside in by a bunch of bureaucrats and
do you think it's going to allow
regulators.
for that?
I do. I think it's asking us to do that. I think that what you just said, because it has really nothing to do with actual physician taking care of patient. It really didn't involve any of that aspect of it. It was about economics. It was about regulations. It was about, bureaucracy. It wasn't about the experience that a patient has with their clinician. It really wasn't about that. You look through those pages, very little of that was about that. And I think that means that they said, here's the game plan, here's the rules. You hospitals and doctors go off and fix it. It's up to you. We're not going to help you. We're just going to tell you what you're going to get paid, how it's going to maybe affect you economically. You got to figure it out.
Chad, we only have 2 minutes left, but we got to get you. I have to get you back here about a year from now or so, because I hope you're right, but time will tell.
I think there's a lot of opportunity ahead of us.
I'm not saying there's not opportunity. I just think that my view of Big Brother is a lot different than yours is. Anyway, with the minute and a half that we have left, if I were to pay you the highest compliment that I could about St. Mary's Hospital, what would it be?
I would say that we get people healthier in our community. That's what we're all about. We're about getting people healthier. And if there was a second one, it would be this notion of value, that we provide great value, which means great quality, great safety at a low cost.
And your community is defined as, I know it's Waterbury, but what's the reach of St. Mary's?
Goes all the way out into the Cheshire, Southington area, down through Beacon Falls, down into Oxford, over to Southbury, up around through Woodbury, and up through next to Bristol into Woket. So we serve a large area, about almost 400,000 people. That's our community, and it's our job to help make the community healthier.
Well, I wish you the best of luck. I think you're absolutely right. A lot of people have applied a lot of words to healthcare. You keep on applying the word opportunity. There's no doubt that there's a lot of opportunity and challenge, and I think you're up to the task, but it's just going to be very interesting when we have you back and see exactly what's happened. Chad, it's been a pleasure.
We're going to create a better mood around healthcare. All right.
It's been great
Thank
having you on. And we'll be back with our show next month.